Do you feel that in a time when we are more connected than ever, we are drifting away from real human connection, especially to ourselves? I do. Hi, I'm Leticia Latino, and I want to invite you to join me and my very inspiring guests in exploring ways to reconnect to your essence, to your definite purpose, to what makes you tick. Are you ready? Hello, and welcome to a new episode of Back to Basics, Reconnecting to the Essence of You. My guest today is David Jones Jr., venture capitalist, community advocate, music lover, and someone with a lifelong front row seat to innovation. David co-founded Chrysalis Ventures with the belief that entrepreneurs in the Midwest and South deserve the same backing as those in Silicon Valley. At the same time, he served on Humana's board for 30 years, helping oversee one of the most significant evolutions in modern healthcare, a journey shaped by watching his father co-found the company. Now, David is diving into some of the most meaningful work of his life, improving end-of-life care, preserving American roots music, pushing for student-focused public education, and helping rebuild local journalism. There's a lot to unpack here, David. So thank you so much for saying yes to Back to Basics.
Oh, I'm so excited to be here, Leticia. Thank you for having me.
Well, when I came with the idea of this podcast, which now is 5 years ago, I was always resonated the idea of how to be successful by staying connected to what matters most and to who we are as people, the humanity in us. So everything I've read and the research I've done about you, it's just like screams that you come from that. So I'm very curious. And I always start the podcast episode there at the origin basis. And then, of course, your heritage from what your father created, I'm sure, intertwines a lot of that early days of life. So can you share a little bit about your young years and what did you dream about and what were you passionate about?
Well, I grew up in Louisville, Kentucky, and there are a couple things about my growing up years. My memories are pretty idyllic. I'm the oldest of five, so I got all the attention benefits that a firstborn child gets. And, I grew up in a relatively small town, but a city nonetheless. And, when I was born, my dad was in law school. My mom was teaching to support him. And, for the first really 12 or 13 years of my life, this thing that he started that he turned into Humana was really nothing. I mean, nobody had, there was no fame or fortune. I learned later how much he had borrowed to start that, which horrified my mother. But the gist of it is, I sort of had a fairly typical upbringing. And then when I was in my teenage years, the company went public and got a lot of attention. But I was a teenager, and whatever it was that my parents were doing was like not top of mind. Top of mind in my teenage years was my peers and sports, and I mean, I love that. I thank you for mentioning my love of music, but I kind of have the passion of a convert on that because I never played a musical instrument until COVID, locked us down here in Louisville. I have a very elderly father-in-law who we were trying to keep healthy. And I started to learn to play the guitar just to keep myself from going nuts. And if I hadn't had that time bonus of not having to travel all the time, that never would have happened. And that's kind of a new love and a new passion. I've been a listener, but not a maker until very recently. But anyway, that's a ramble. There are a lot of topics here, and
no, but those are the ones I love because I do research on all my guests, and I mean, you do have a picture with a guitar on LinkedIn, so it definitely it's important. Even if it's a newer love, it definitely shows that there's something that makes you connect with what makes you tick there.
Yeah, and if I can just say a little bit, I know I'm hoping to talk about my father's book, but
Yes.
one of the most exciting things that has happened to me in 2025 is I venture capitalists are connectors. That's one of the things we do. We help people who have a great idea or a capability meet other people. And I got to know a wonderful old blues musician who had turned into a guitar maker, a luthier, down in very rural North Carolina, a gentleman named Freeman Vines. And Freeman made beautiful, fascinating guitars, but he was also a philosopher and he was 82 and he passed several months ago. But
Mm.
I introduced him to a friend, him and another one of his buddies, but to a friend who's a filmmaker. And just a couple weeks ago, the guy made a short documentary about it that I am credited as an executive producer
Oh,
on.
wow.
I've never done anything like that before, but it just got nominated for an Oscar in the short documentary category, and it's called Freeman Vines. I'm happy to send you the link if it's
I
interesting, but
would love to.
it's
I get
such
chills just by hearing that.
it's
One
such a
connection.
it's a beautiful story, and it also is a beautiful story about the family and friends and the community that supported Freeman in his elder years. He had cancer, he had every kind of health problem,
Mhm.
but he worked on making his guitars with great passion up to the very, very, very end. And his life was he had meaning, but partly because he was a passionate man and a wonderful man, but also because he had family and community in a smaller town that made it possible. And I think it's just a beautiful story. I'm amazed
I
that it is having, that's getting attention.
I love it. I love. You see, this is why I do this podcast because somebody would say, "Well, you're interviewing, the son of I," which I didn't know. When I saw first you were, and then I started doing the research. I say, "Wow, his father. It's very impressive, right?" But
Yeah,
but it's small things like this that you are a very successful entrepreneur. You've co-founded a VC company, but then to talk about one connection that highlighted such a beautiful story, such a
yeah.
beautiful work, and now it produces a documentary that is Oscar
It's
nominated.
just
This is how
amazing.
things happen.
Yeah. And again, it's partly because this random COVID thing got me, really engaged in music, which, I rarely say, oh, one of the wonderful things about COVID was blah, blah. I mean, that's not
Yeah, yeah,
something you say very often.
yeah,
But
yeah.
in this case, it brought more music into my life. What a
Well, I
blessing.
definitely will watch it now. I mean, obviously, we share off camera that my husband is a musician. He's my episode number, I think, 3 of the
Wow.
podcast. Now you're gonna be
Cool.
300 and
Oh, I'll
some.
have to go back and listen.
Yeah, yeah. So I think you would enjoy. He has a fascinating story, but yeah, it's music connects people. That's
It
one
does.
thing that we always talk about. That music connects people. And so to go back to your younger years, you said something interesting. Which to me, my father was building this thing, but I didn't realize what it was. And as a mom that works, and I have Sicilian background, so being present in the family is very
Yeah.
important to certain cultures, right? And we
Yes. Yeah. Yeah.
struggle. And my kid once said, "Oh, my mom doesn't work," and the people went like, "What? Your mom works a lot?" And I say, "Well, hold on. If he doesn't think I work, I'm doing
Yeah.
something good
Yeah.
because that means I'm present for him when
Hmm.
they need me, right?" So tell us a little bit about that upbringing, having a father that was creating an empire, but I know for what I read that he was very set on coming home for dinner every day, and that
Yeah.
being normal at home,
Yeah.
regardless what you were building.
Well, I think the first thing to say is it was a shared commitment that he and my mother, made to each other. They met in college at the University of Louisville, and Dad grew up on, what we would say was the wrong side of the tracks in Louisville.
Mm,
His dad was a laborer. His mom, eventually she worked in a laundry and then eventually got a job in the Census Bureau. But that was during the Depression, and he always said, "Look, everybody in the neighborhood was poor, and therefore we had no idea that we were poor." And
mm, mm,
but my mom's father was a pharmacist, and her mom was a teacher, so they had steady paychecks all the
mm,
way through the Depression. But when my parents met, my mom was the like voted the most promising freshman or something at the university.
Mhm.
And my dad was on a ROTC scholarship from the Navy. And, he just thought he won the prize, um,
Mm.
when she took up with him. And she's a great student, a great mind, very disciplined. And it was great to have a mom who was passionate about education and also pretty disciplined.
Mm.
And so being home for dinner, keeping my dad from, Kentucky's sort of in the South. We say, you can get too big for your raisin. And
Mhm.
she was a good break on that kind of stuff. But, dad made a huge effort and, you know, built his way of leading partly around one of his values, which was you have to have a life. You have to have, you got to put your family first. You got to put your relationships first. And family first included supporting his parents and
Mhm.
he was one of six, second oldest. So there was a lot of, as he began getting a paycheck, he and his older brother, that was, getting his parents into a home, ultimately a home that they owned, all of those things. Anyway, I can go on, but the
Mhm.
early years and the pathway and the examples that I had were quite wonderful. And then, when things really started to work, I mean, he'd probably be mad at me for telling this story, but
No,
and
please.
it's not in the book. But
Oh, great.
I
Those
have
are
a
the ones I look.
I have a very clear memory one time when he came home for dinner and he came roaring through the door. He'd been something really important was happening. I don't know what I can't remember. I probably didn't know what it was, but he sat down, just came in, sat down, ate. We were all at the table. I mean, it's five kids. It was always a zoo. My mom always said that that's what I said at the time. It was a zoo. But and then he gets up and he just gets up and starts to walk away. And my mom and the next child, my sister, who was a year younger than me, they both looked at him and said, "What are you doing?" And he's like, "Well, I'm done." And they're like, "No, you're not done. I mean, people made this move." Anyway, they basically said, "We're going to have a new rule. You're going to clean the kitchen, and you and the boys are going to, so like, get on there. You're such a great leader. Um, get everybody over there by the sink."
Oh.
And from that, and that was a division of labor from there on. But it was, again, it was a like, hey, this is a partnership, and we do. And I'm not saying my parents were saints. Their marriage took a lot of work. I think all marriages, you know, I mean, they have hopefully a lot of love and passion and support, but they're not naturally going to succeed if people don't try,
Mhm.
is at least the model that I saw and try to live
Yeah.
by. But anyway, that there's a lot to that. And but my parents came to ball games, they came to school events. I mean, if there was a parent teacher conference and there was information that the teacher needed to tell them, it was heard and it was acted on at home, very
Mm.
much. So it
That,
was
I
it was
I
good.
love to hear that because I think a lot of people, you hear people that because of their success of what they're building, they say,
Yeah,
I don't have time for this, or it's either I do this or I do
yeah,
that. Like
right.
they don't find the way to intertwine life. It's
Yeah,
like it's all work or it's family, but that, so to me, it's very inspiring to when I see amazing examples and also people that were genuinely interested in community and really contributing and leaving the
yeah,
world a better place, hopefully, than what they found. And of course,
yeah,
being on the health system, I know this is something
yeah,
that it's very, you were on the board of Humana and there's so many things as a foreigner into the
yeah.
US. One of the things that you hear often, it's this is a great country except for and
Yeah,
health system, it's always
exactly right. Right.
one of the things
Yeah.
that the Europeans and other nationalities challenge a bit. What do you want to share on that, on the work that both the legacy that was built, but also how you contributed to preserving that legacy and prevent it from becoming what it has become, unfortunately?
Well, it's a huge topic, and you can just hold up a timeout symbol
Yeah,
whenever
yeah.
if
No,
I
no.
rattle on too long. But I think the complexity, the bureaucracy, the cost of our healthcare system, all of those are, they're really maddening issues. And the lack of access that so many people in the United States have. And when I say, I mean, lack of access, that's like, okay, people talking about lack of access, but there are many reasons for it. And it's not distributed according to the same ways that other, in theory, we're a capitalist country where you get what you pay for, but healthcare is not that kind of a system. Healthcare is, what you get depends if you're under 65, largely on who you work for.
Mhm,
How much you pay is influenced by who you work for and what your income is. Because if you're poor below a certain point, then you're in a government program and there are cutoffs.
mhm,
And so there's all of that complexity, but there's also, a lot of miraculous innovation, particularly in drug discovery, in devices, in surgical techniques. All of that is very heavily in the lane of what gets paid for. And in my venture capital work, my searches for innovation have been heavily focused on not only what works, what is effective, but also what is efficient so that it can
mhm,
be affordable. And that is largely about how do we get processes that are more efficient? So if I can jump for a moment, to end of life care, which is my current passion. I'm happy to that a lot of that was learned from being the family caregiver for my dad in his
mhm,
last days. Um, you know, that's the most expensive time of life. We spend, the biggest chunk of our healthcare spending at the individual level in the last year or the
mhm,
final illness. And these are not dollars that people or their families celebrate. It's often complicated and people are bouncing around and they don't know what's happening. At
mhm,
some point, the body moves from being a human being to being a collection of organs, each one of which has a different specialist and a different
mhm,
waiting room to go to. And to me, that is a very important but a very difficult problem to be solved. And so that's an example. Um, and um, I mean, I'm happy to talk about the kind of specific issues at the moment in healthcare. My sense is your podcast and your listeners are more on the human side. So if I
mhm.
can, I'm assuming you have a lot of people in South Florida who are listening, but
Yes.
one of the things, and I'm not 100% sure that I'm right about this, but it's based on my experience. One of the things I've observed is that the influence of the Cuban healthcare system in South Florida on the delivery of primary care has been very positive and is a really important example from
Mhm,
which some parts of the country are doing it the same way. California, some of New England, but most of the country doesn't. And, if I understand it right, when Cuba was a poor country back,
mhm,
before the big immigration started to happen, they had a lot of rural, health workers who were much lower
mhm,
level than doctors. And the model was very much build kind of a community center with health support there, where you can get
mhm,
basic drugs, you can get seen. And that community center first, a place for people to be welcome and to come to, is what I've observed. And this is largely through Humana, some through, other companies. But, South Florida is very unusual in having these very big, community, I think of them as community centers, but that are
mhm,
primary care centers. They have everything from places to play games, dancing, music,
mhm,
coffee, hair,
mhm,
hairstyling, but things that invite people in. And the core model is come here not just for your medical appointments, and they're focused on old people. So,
Mm-hmm.
um, and they're paid for very differently too. They take the the healthcare community calls it, they take risk. And so they take on the cost of caring for people. And if they keep them out of the hospital by keeping them healthier, they have economic success. And if
Mm-hmm.
they just refer them on to the specialists every time they come in, then they don't do so well. But, I'm pretty convinced that the poor, um, lonely, potentially lonely, you know, elderly person who is treated in one of those centers gets better care than my dad got when he got diagnosed with multiple myeloma. And he got wonderful specialty care and
Mm-hmm.
he had loving nurses, but he had to schlep around from point A to point B and everywhere, and it was
Mm-hmm.
all uncoordinated. It wasn't in an environment of, everybody knew him and everybody knew what was going
Mm-hmm.
on, and everybody knew the kind of the burden that was because my mom was failing at the same time. The social determinants. So anyway, I'm sorry. I wish I could figure out how to describe this more succinctly, but
Mm-hmm.
I think,
Yeah.
the influence of that care pattern as it matured in a wealthier environment has been, really positive and really interesting. And I love to go visit those centers. And
Mm-hmm.
I almost always wind up dancing with one of, and on be there for one of the days when they've got, a band or something in there at lunchtime. And
Yeah,
it's cool because loneliness is a real problem for older
it is.
people. And
It is.
a place where you're welcome is really important.
I think it's very well, obviously coming from a very valuable perspective. And if I just may add, as a Venezuelan,
Yeah,
the fact that the relationship, that community extends the doctor. So the doctor becomes your friend in a way, and
exactly.
he
Yep,
follows your journey and is not in any rush to kick you out. So one the other thing that you see down here, it's a lot of self-insured people
right.
because at least for that first front line of
Yeah,
care, because they don't
yep,
want to let go of that friend,
yep,
even
yep,
if they
yep,
have to pay out of pocket, because they know, like I
yeah,
normally say, with one visit to my doctor from always,
yeah,
he will avoid four different visits to specialty care
yeah.
from a doctor that I don't know here.
You said it much better than I did. That's the core of it. And most of my focus is on the 65 and older population, but it is of course true of younger people. If you can, and it's not only true of healthcare. If you can be in a community where you're known, you know, you get help,
Yeah,
right?
yeah,
It's
yeah,
easier to
yeah,
get help.
yeah.
And it's the doctors are really important, but it's not only the doctors. I mean, one of my observations in these big, 5-story primary care, I mean, the rest of the country doesn't even know what that is.
Hmm.
Um, but um, these older people, they walk in the door and the people at the front desk jump up and hug them and know them by sight,
Hmm.
and
Yeah,
the nurses and the lower credentialed, lower paid aides. Everybody knows everybody.
yeah,
And
yeah, yeah.
it's really that human connection
Yeah.
is really important. And now you're
Yeah,
saying,
well, your
what
dad
about
was onto
AI?
something with that. Yes, yes, with the name Humana, because we are
Yeah,
taking humanity out of everything.
yeah,
We are doing a disservice to ourselves. And I'm in telecom.
yeah,
We were talking about it, and I definitely want to hear about technology and innovation. But we are really dehumanizing everything to the point where we become. And I know this is something, and it's the last question I'll do about the healthcare system. But I know you have an opinion on your perspective about what happened to the CEO of United Healthcare, because
yeah,
again, it's like you hear somebody, it's like, no, that shouldn't happen at all. The fact that we're even arguing, like, but when you
yeah.
hear people that they feel vindicated because many times they have felt mistreated by their insurance or
Right, right.
abandoned by their insurance, or that there's no fairness. It's a complicated issue.
Yeah. It is. I mean, I think, to me, we got to start with political assassination is awful. And
Mm-hmm.
whether it's a elected official or an advocate or an executive, and that was a political assassination, Brian
Mm-hmm.
Thompson. And, that's not the way we want to live. I mean, if the country is going to work the way, to at least to me, that, you know, is a big part of my pride, in being an American. It's we have a way. It's not that we're all perfect people and we always get
Mm-hmm.
along. It's that
Mm-hmm.
we have a
Mm-hmm.
way of peacefully coming to a way of going forward, not coming to consensus because we always disagree. And any kind of political assassination is just catastrophe to me in that frame. But, you know, I do understand why people are frustrated, with insurance. I do understand why people are frustrated with bureaucracies of all kinds. And, I think you know, the thing that um, I guess I don't know. There's so many different directions it could go to.
Mm-hmm.
We're probably both paying attention to the Minnesota story about the corruption in their Medicaid program and blaming it
Mm-hmm.
all on the Somalis and
Mm-hmm.
whatever's happening there. But I'm to the extent I'm a healthcare nerd and a health insurance nerd, my first thought of that was like, wow, that sounds completely idiotic because, one of the things people hate about healthcare, health insurance is it's so complicated. Well, one of the reasons it's so complicated is because fraud is a big issue in healthcare. It's a big issue in government programs everywhere. And insurance companies, hospitals, I mean, these big organizations have massive investments in fraud detection and fraud
Mm-hmm.
prevention and fraud recovery. And, you know, the governments are not always, they operate at a much, much higher level when they pay for things. And as we see in that Minnesota example, they're not always good at it. And that's
Mm-hmm.
why they hire private contractors. That's a lot of what sort of the private Medicare program is about, is trying to manage costs to avoid fraud, to avoid abuse, to avoid unnecessary care. And it's not something that anybody loves, but you run your own business, you got, if you don't pay attention to where the money's going, you're going to find that other people have it sliding into their pockets when they shouldn't.
That's a great point. And so, from your perspective, because you are an investor, you invest, you're an innovator,
Yeah.
do you think what are you seeing in terms of innovation trends that could maybe make the that industry less corrupt, less open to these kind of schemes? Is there hope that innovation can help solve some of those issues?
Yeah. I mean, I think there always is hope. I mean, there's like, we gotta always prune the garden. We gotta always be alert for whatever the new scam is. But it's not just most, the overwhelming majority of people, and certainly doctors and nurses, I mean, people in healthcare are mostly driven by, care and by love, tiny minority to deal with. But the things that are exciting to me, I do think AI has tremendous potential. And, this is not the part that most people find the most exciting, but a lot of healthcare administrative costs are because what we said earlier, where what care you get and how much you pay depends on where you work and all these other,
Mm-hmm.
things about a complicated, varied system. AI is great at integrating different databases and getting to an accurate answer or identifying inconsistencies that you can
Mm-hmm.
get to. And, some of the early, results, and it's not perfect, it's still improving, it's still learning, are just fantastic at how much time can be saved from people calling or faxing. They still fax in
Mm.
healthcare, if you can
Yeah,
believe it.
it's
But if how this bill, that bill, this, that, and the other. there's, maybe 2 or 3 or maybe even 5% of the total healthcare costs that could be saved just by getting things agreed upon. This is
Mm-hmm.
X, this is Y. And, that sounds really boring, but and it will eliminate a whole lot of jobs, a whole lot of clerical jobs in healthcare. So it's not going to be an unalloyed celebration. But
Mm-hmm.
the public and the paying, anyone who's paying for any part of healthcare is going to celebrate that going down. So that's one thing that's really a big deal. Another thing that I'm hopeful about, but I am not yet seeing coming into functional usage, maybe I'm just not catching it. A lot of patients and their families are really confused. You see the doctor, they tell you, oh, this, that, and the other, and then you leave, and the data is a very high percentage of people don't understand
Mm-hmm.
what's happening. You get a sheet of paper that says do this, do that, and that's really confusing. And then particularly if your family is not with you or whoever's going to help you, if you're not alone, how do you share that? It's like a game of telephone. What happened
Mm-hmm.
gets misstated, and there's just mass confusion. And that's where you know, here's my blood test, or here are the words that the doctor
Mm-hmm.
told me. What does that mean? I mean, these
Mm-hmm.
kinds of things I think can be much, much, much better explained than they are today. And usually this gets some kind of a, wait a minute, you can't replace the doctor's wisdom and humanity. And I'm not eager to replace the doctor's wisdom and humanity, but for a very, very large majority of the population, they don't have enough time with the doctor, and those communications
Mm-hmm.
are not good enough within the complexity of what is going on. So I think that is very exciting. Last point, I'll make a third point and then shut up. I think for particularly rural areas and sort of clinical deserts, some of those are in inner cities, some of them are in, and again, Miami is a little different because of the care models and
We're different in everything.
they're different, yeah, different in everything. But in this area, I think a lot of it is exciting because there are care models that work there that other places have not adopted. But there are a lot of places in the country where, you know, the to see a doctor, you have to drive 2 hours, sometimes more.
Mhm.
Um, and that is where I think the efficiency of diagnosis, the communication, the um, again, it's about access. If for a lot of
Mhm.
people, particularly if you have a musculoskeletal injury, travel 2 hours, that means
Mhm.
that means you don't get care,
Yeah.
right? And
Yeah.
take a day off from work. That means whatever your insurance situation is, the cost of doing that is that much higher. And
Mhm.
these are really, to me, these are promising and exciting things. And there's a whole nother thing that we could talk about new drugs, GLP-1s. I mean, I can go on and on, but bump me back into what you think people
No,
might
it
be
just it's,
interested
it's
in.
just fascinating. I think my first thought is like what you mentioned about jobs, because in telecommunications we have the same thing. So you have industries that are very advanced in one front,
Yeah,
so like medicine, very advanced, very
very, very.
innovative, and then the back office is like in prehistoric times. Every time I
That's
have to
right.
fill out 15 pages that
Yeah,
my doctor asked me to fill again, it's like we have to be doing this better. There has to be a better way, and I think COVID improved that a lot, right? Because they
yeah,
didn't want you in the waiting room at the same
yeah,
time. So
yeah.
now they're respecting the times. Now they're doing as much as you can from home.
That's
Now,
right.
so that push automation, and I think that was a positive.
That is a positive. And actually, you give me a new. I'm going to think about this example, but my understanding my cell phone contract is another thing that maybe AI could help me with. just like you
Yeah,
could help
yeah.
me understand what I
Good point.
don't.
Yeah, is the how-to of AI. Yes, because
Yeah.
we do need this, and I totally agree with you that it's almost like that consulting, like AI agents will be that lower level expert. Like if you
Yeah.
don't want to pay a doctor, just give me a little more info so that I understand what I'm dealing
Yeah.
here with.
Hey, let me say one other thing about healthcare because I don't want to I mean it's I am optimistic that things are going to get better, but I think it's a time right now where we also I want to not be smiling here and stuff. The cost pressure right now, the way insurance costs are going up and out-of-pocket costs are going up. It is a really serious issue.
Mm-hmm.
There are reasons for it. Labor costs are, inflation there, the new drugs that are miraculous. There are good and bad reasons for it. But one of the realities in the healthcare system is that the average American family cannot afford to pay the average cost of care that they are going to receive across the years of their life, the actuarial cost. And that's a real problem.
Mm-hmm.
There are, and that's one where I think our public sector, sort of sloganeering and antagonism are not serving us well. It's going to require, you know, not just one, but multiple iterations of
Mm-hmm.
of improvement and you know but ultimately there's going to be some subsidies
Mm-hmm.
because the costs are just too high or we're just going to have to say politically, well, tough luck. Half of Americans don't get good health care. And you know I think again it's a choice that the voters should be able to make one way or another. From my perspective, I don't think we're going to say, hey, tough luck, half the people. I mean, we've never done that before. We've moved
Yeah,
toward
yeah.
how do we get coverage? But right now the costs are really out of control.
Yeah, I totally agree. And as a foreigner, again, the first time I heard, well, if you use your insurance, it's gonna cost you 5,000, and if you go
Yeah,
straight and you pay to the hospital, it's gonna cost you 2,000. I'm like,
yeah,
like
yeah,
that is really hard to wrap your head around. Every time I tell this, like, what if I pay with insurance? Like, it's
yeah.
just crazy. It's
Well, it's just
counterintuitive.
crazy, and it is. I mean, if you're, you've got private insurance, you're under 65. Once you turn
Roughly.
65, effectively you sort of move to Canada or Germany.
Mm. Yeah,
You have
yeah.
everybody has the same basic insurance plan. And
Mm.
then it's income adjusted. If your income is below a certain amount, and I think most Americans don't fully appreciate that. We've got this universal coverage program. Its cost to the taxpayer is going up like crazy, but
Mhm.
it does cover people. Um,
Yeah.
People who come out of a good corporate plan are shocked by how expensive, I mean, how much Medicare does not cover. The
Hmm.
out-of-pockets are much higher than a lot of people pay. But anyway, I shouldn't be blabbing about
Yeah,
that
it's
stuff. But it's a
a
real thing. I mean, and it makes people nuts because like it's like being on an airplane and you pay X dollars and the person next to you pays, you know, a half X for
yeah,
your seat.
yeah. It's very, very, very strange, but I'm happy. It gives me hope to know that, of course, you serve on the board of Humana, and that to have people that are preserving legacy, many of these companies have, were founded really with a human centric approach
Yeah,
that we don't want lost. So I know your father wrote a memoir, and I know you're
yeah,
very
yeah, yeah.
passionate about promoting. What can you share? Yes,
There we
I'm
go.
gonna read it because I
Good.
just by doing the research, I say, wow, as an entrepreneur myself and coming from a family business, I'm like, okay, I'm sure I'm gonna enjoy it. What's do you think the biggest takeaway that people that you have talked to are taking from your dad's memoir?
Um, so I'll give you a couple of examples, and I'll start with the human kind of motivation. You know, what became Humana started when my dad and one of the, and he was a second year lawyer, or the first year lawyer in his practice. The two of them said, we should build a nursing home. And they borrowed $1,000 each, and that was the capital contribution. But the reason they did that, they my dad knew somebody from high school who had done that, and it worked. But each of them had an experience with their grandmother, who, when she got too old, was put in what was then a nursing home. And the first thing they did
Mhm.
was build this nursing home. Well, what they had seen with their grandmothers was where they went was a neighbor's house, and the neighbor would take in four or five or six elderly people and care for them while the others were working. And there was no care. I mean, often their arms were tied to the rocking chair so they wouldn't fall out, and they just sat there all day. Um,
Mhm.
and it was pretty horrifying. So the
Mhm.
original idea was, hey, this can be better. And then this started in 1961, so a
Mm.
long time
Wow.
ago. And
Wow.
so let's build a modern building with a hospital bed that can sit up and sit down and a nurse on duty. So the business insights were there from the beginning. These guys were smart. They knew how to finance real estate. So there's a business story, but that motivation is the kind of thing that people today look around also and see problems that
Mhm.
are, see things that are, they might be unjust, they might be too expensive, they might be bad service, or they just might be missing. And
Mhm.
that's the way entrepreneurs think. And that's a cool part of the story. Another part, my dad has a list of like the lessons that he learned along the way. And, a couple of the lessons I think are really important for entrepreneurs. And, I'm curious how you manage it. We'll have to talk again. But his number one advice to me and to other entrepreneurs, the hardest one for me to follow, was focus. Focus,
Mhm.
focus,
Mhm.
focus. You can do anything, but you can't do everything, right?
Mhm.
Those kinds of things. Don't chase every rabbit or you won't catch any of them.
Mhm.
And then also, really interesting lessons about failure, because lots of things didn't work. Looking backwards, my dad was very
Mhm.
successful. It looks like, everything was perfect. Oh man, they've made some colossal mistakes that almost killed their enterprise along the way. They, at one point, they decided we're geniuses in real estate finance, so we should start building mobile home parks.
Mhm.
I was like, huh. Nobody tells that story very often anymore. It
Yeah.
was a complete disaster. They lost their
Mm.
shirt. The only time in like the first 40 years that the company ever had a loss
Mhm.
during a
Mhm.
year, and they
Mhm.
shut it down. It was, but so that kind of thing was crazy. And then the last thing I'll just point to, and I think that my dad does a beautiful job in the book of describing these things, but personal resilience is really important. And I haven't listened to all of your podcasts, but I looked at the, kind of the list, and you've had people talking about, grief and about overcoming things. You know, um, it's still hard for me to talk about this without getting emotional, but
Mm.
I didn't understand this until I edited my dad's book after he passed and,
Mm.
helped get it published. But he lost every single one of his closest male friends, five of them,
Mm. Mm.
very, very early in their 30s to early
Mm.
50s, including his
Mm.
older brother,
Mm.
his best friend from college, best friend from law school, his business
Oof.
partner in starting and building Humana. And I didn't perceive that as,
Mm.
as his oldest child.
Mhm.
I mean, I knew these people well, and they were in a couple cases also, they were mentors and important people to me, but he just was able to keep his personal balance. And,
Mm.
as a leader, I mean, he didn't hide his grief or his sorrow, but
Mhm.
and I don't know how one does that, but every single one of us is going to have some big bumps, right,
Mhm.
in our lives.
That's
And
yes.
that's another piece that, I think, and again, this is not mainly a business book. it's a memoir, it's a life story. It's the story of building Humana is very much in there, and it's great from that perspective. But anyway, those, focus, if it doesn't kill you, get out of it, and it can make you stronger. And then, you have to have your own resilience, your own methodology of getting, whether it's, faith or exercise or, friends and loved ones who prop you up. Those are really
Mm.
important.
Thank you for sharing that. That's, and what came to mind, it's like probably that's why he was present. Probably that's why he went to put family first, because
Yeah.
when you lose
Yeah. That's right.
friends so early on, you
That's right.
really realize that you're
Yeah.
lucky to be there and to
Yeah.
have your family and to have your kids. And sometimes that's what has to happen for you to really acknowledge and be grateful. It's sad, but it's what they say: something good comes out of something bad. I really
When the good
think
comes, yeah. Yeah, no, I think
of something
that's
like
right.
that.
Yeah.
So and
Right.
that's yeah, that's sad, but the fact that he also didn't put that situation, like I lost so many friends, but people victimize themselves. So
Yeah.
it's very inspiring. Definitely look forward to reading the book. I know you have, I mean, you are a
I
philanthropist.
do.
You help you're passionate about journalism, education. What haven't we not talked about that you want to highlight? I always like to give my guest I know we haven't talked about a lot of stuff, but
Yeah.
something that's making you tick these days that you're passionate about that you want to highlight for the audience.
That's a good closing question. I think so, one of the things I saw, most of your guests, it looks like, are women. I'm guessing your audience is tilted
Yeah,
female.
say,
I used to be in the radio business also, so it's like
yeah, yeah,
ancient
yeah, yeah.
history. But one of the things that's very much on my mind, and again, it's a healthcare nerd. It relates to the music that we talked about early on, but um, there's a lot of research that as men age, um, they are not as good on average as women are at maintaining their social networks, and are at risk of getting themselves isolated and
Mhm,
lonely. And I'm I'm spending more time, first of all, trying to learn about that because I think it's very relevant to this end of life care because one's social network and social determinants of health are really important from a like policy and business perspective. But it's also, as an individual, um, I'm 67.
mhm.
I
Yeah,
used to
yeah.
be I did triathlons for a long time. I had a running group and a cycling group and a swim team. And now the only one of those that I still do is swim. So
Mhm,
those social groups have fallen away. And, how do I keep myself engaged? I love to
mhm,
read. I've got a great book club.
mhm,
I've got great colleagues at work, and I am having trouble envisioning retirement, whatever that, but that's unrealistic.
mhm,
So anyway, I think that's a important topic right now that I view it as kind of a learning journey, but one with more immediate application
mhm,
to myself. And that's where, like, in this learning to play the guitar journey, I mean, I've gotten to the
mhm,
point where I'm starting to sort of jam with other people, and
mhm,
that is so intimidating because
mhm,
I'm always the least skilled person in the circle, and usually the newest, to playing an instrument at all. So it's very intimidating, but it's very rewarding because I mean, musicians are different from runners and cyclists and
mhm.
soccer players and all the other things I've been part of and so anyway, the people are just endlessly fascinating. That's the gist of it. And making yourself, you know, get up off the couch and get into some kind of a group activity is a good thing.
But I love the fact that you are not, when you are open to being, I mean, considering your journey, your expertise, all the things you've done, to be in a position where, well, I'm the young, like newest musician. I
Yeah.
think that's very empowering, honestly.
Yeah.
And it makes you feel, and it's fresh, and I find exciting when I'm learning something new
Yeah.
also. It's well, I started learning the piano at 30
Oh,
and I
good for
did it
you. Yeah. Yeah. Yeah.
for 6 years, but that's intimidating too. I'm like, I think it's the only thing I failed at. You realize to learn an instrument very well, you need a lot of time.
You
You
do need a
really
lot of
do.
time, but it's not just because you haven't finished doesn't mean you failed.
That is true. Thank you for that reminder. Absolutely.
Yeah.
Absolutely.
Yeah.
So, I mean, David, I'm so grateful for your time, for the inspiration. It's extremely inspiring to just hear all the incredible things you're doing, and how you're uh, eh, making the legacy of a very important legacy, I think, and also end of life care. Something I'm very passionate about. The more you grow old, like to me, unfortunately, my mother-in-law is probably in those days, and I just realized last week, and
Oh, I'm
like the
sorry.
the
Yeah.
yeah, it's sad, and you realize that when you get to that point, you want to do more, and you don't know
Mhm.
what you can do,
Right.
and
Right. Right.
it
Right.
feels powerless in a
Yeah.
way. So I did tell my husband, like, I'm gonna find a way to give back, because for children, everybody loves children. They're cute, they're nice, but the
Yeah.
elderly, on the
Yeah.
other hand, it's
Yeah.
almost like nobody wants to deal with it because it
Yeah.
reminds us where we're going, I
That's
think.
right. Well, and
And,
there's also, and I hope you've had folks on to talk about this before. You probably have, but the caregiver, the family caregiver burden is huge. And
mhm,
it's, in my experience, and I was shocked at how hard it was. I mean, in theory, I'm an expert in how to navigate healthcare. In practice, it's much easier to work at a whiteboard than to try to help
mhm,
your own
mhm,
parent.
mhm,
And every single other family caregiver who I've met and talked to has, I mean, it's like a universal experience. This is so much
mhm,
harder than it needs to
mhm,
be,
mhm,
but also a great many of them are just, they never talk to anybody about it.
mhm,
They don't bring it into work because many
mhm,
people are worried about their jobs if they're
mhm,
perceived
mhm,
as getting pulled in too many different directions. Other people just don't want to be a downer. People don't
mhm,
bring it up in social environments. Again, they don't want to bring everybody else down, or they don't,
mhm,
somehow we don't have permission space in our culture
mhm,
sometimes. But that is a real issue. And again, I'm a healthcare data nerd, the burden on the family caregivers, especially during COVID when there was extra isolation with kids in the
mhm.
home too, it was off the charts. More than half of family caregivers reported suicidal ideation at that time. It
Wow.
spiked up because of
Wow.
those other pressures, but there is an enormous amount of private, um, not just grief, but carrying these loads that we can't see on each other.
Mhm, mhm.
And anyway,
No,
it's
thank
a
you.
really important topic. So, okay.
Absolutely.
All right.
Absolutely. Well, thank you. My last question is very quick. It's, what makes you tick about all the other things, when those days when you feel down, if you do something, connect to who you are, what would it be?
So I am a sort of borderline introvert. So when I need to, sort of reboot myself, I tend to do something by myself. I'd say you know, the to maintain an even keel, the best thing is exercise.
Mm-hmm.
So I went to swim practice this morning, for an hour. I've got lane mates who, we tease each other and make each other work harder than we otherwise would. But that, sort of physical endorphins and all that is really important at this stage. But it's also, often I'll get up and just sit down and read a book. Not, and it doesn't have to be a book. It can be, but on a non-multitasking tool. It can
Mm-hmm.
be a Kindle or it can be a hard copy book or magazine, but let my mind concentrate and not wander off into whatever is bringing me down or whatever I'm worried about. Um, And then the last thing is, this guitar thing. I mean, if I've reached a point, and I love the old finger picking blues like Mississippi John Hurt, and I
Mm-hmm.
mean some of those little things. If I've gotten to the point where I've got the pattern down and just need to practice it, I can actually lose myself for an hour or so. And that's really restorative.
Wow. Oh, that's great. Great things that make you tick: physical, internal concentration, and then music. And
Yeah. And
beautiful.
but we're all different. So, I mean, other people are like, I just got to go out and be with people. I mean, one of
Absolutely. Yeah.
my best friend is like, he, I mean, he just he goes out and walks down the street with his dog just to meet people who will talk to him. And that's his restorative is being with
Social
people.
being,
He's a social
connecting.
critter. He is a social critter. Yeah.
Yeah, yeah,
Anyway,
yeah. Well, that's a good contact to have. Well,
yeah. All
David,
right.
thank you so much,
Patricia,
and
great to talk to you. Really enjoyed it.
likewise, and thank you everybody for tuning in until the last episode of Back to Basics. Bye bye.
Bye-bye.
You've been listening to Back to Basics. You can follow us on Instagram and Facebook. If you haven't yet, subscribe, rate, and review this podcast on Apple Podcast or any of your favorite streaming platforms. This is the best gift you can give us. Join me next week for another Back to Basics conversation. And if you want to find out about other exciting things I'm working on, visit leticialatino.com. Thank you, and until the next time.